Well, this is a continuation of what does the dang thing cost? Message for the administrators of the hospital, perhaps in the financial accounting, the billing department, or those that are doing the office billing for private practice. I'd like to talk to you a little bit about how you could migrate into a pay at time of service and encourage those that have a health savings account to come to your hospital or your clinic. And why would you want to do this? Well, way back when, my buddy and I, Vern Cheretenko, and I started something called Simple Care, and we figured out it cost us so much to recover payment for our services. We thought, why don't we just have them pay at time of service and cut all of that billing and rebilling effort? And so it cost us so much to go after money from some insurance carriers, it actually just wasn't worth it. And so we had this crazy idea, is it possible to get our accounts receivables down to zero? Whoa, boy, some of you may think, accounts receivable down to zero, what does that mean? Those that are involved in billing, you know exactly what it means. And if your accounts receivables are down to zero, you know where you're at the end of each day, each week, each month. And it might sound like a pipe dream, but it's a reality that can happen if you change the way you're currently practicing. And so you might be intimidated thinking, gosh, we have some patients that pay at time of service and we give them a discount. And that sounds great, but let's talk about discount for a minute and then talk about a reality check of what things cost. So if you give a discount and somebody comes in and they say, well, we give a 50% discount, that sounds really good. In fact, an 80% discount, whoa, that sounds even better. And is an 80% discount better than a 50% discount? Well, you have to ask, discounting what? So if you're doing a 50% discount of a $400 visit, that's $200. If you're doing an 80% discount of $1,000, well, that's $200. So what is the benefit of a discount unless you know what the real costs are? And that's what you have to actually recognize as an administrator. What does the dang thing cost? What is the cost? The procedure, the office visit, the lab, what does the dang thing cost? There are procedure codes, CPT codes. I'm sure you know about them. Those codes pretty much give you guidance on what you can and should do. So a CPT code for an office visit, a 99204, initial visit, certain amount of complexity, a more complex visit, a 99205. What do you charge the patient and what do you get paid back from the insurance carrier? Well, let's just look at that. A 99204, 99205 really doesn't mean anything unless you know how much you're getting paid for that event. And if you just set a price and say, this is what we need to accept for that office visit, let the patient know this is what it costs. And those with a health savings account will pay at time of service. And talking about a 99204, as an office manager, you know that you charge a certain amount for a 99204, and then you wait to see what the insurance carriers that you work with will pay you for that visit. So look at the average reimbursement that you accept from insurance carriers and charge that for those that are paying cash. That way we level the playing field on what it costs to come and see you to have that procedure or that imaging, whatever it is. So it's not that complicated, really. What's complicated is people coming in with a health savings account or they do not have insurance and you give them a 50% discount of an inflated price. It really doesn't help them and it's actually really confusing. So let's eliminate all the chaos. If you're a hospital administrator, this is supposed to be part of your daily activities. Hospital prices are supposed to be very transparent. And there have been a few very legislative activities in that regard. And if hospitals don't comply with transparency, they may lose their nonprofit status, and I think they should. And why do I say that? We started Embrace Virginia to be a voice for that have no voice for this very reason. there were so many people that had bills from hospitals and other medical events that they caused so many bankruptcies. In fact, over 2/3 of bankruptcies are related to medical bills. And when I review the bills that they're given, they are inflated beyond what the hospital accepts from insurance carriers or the doctor's office accepts. We have to stop this chaos. And as an administrator, you can and should be part of this transparency that's needed. Because healthcare is migrating away from an insurance-driven and more information-driven. Insurance-driven is this: people look for an insurance product that pays and covers everything, and they think that's great. Problem with that, and we're dealing with it right now, is insurance-driven approach really increase out of proportion to the real cost. And why? The individual does not know what things cost, and quite frankly, many of them don't care if their insurance covers it. If their insurance doesn't cover it, now they care. And they care a lot because they think, wow, this is amazing. And the sad thing is, some people will have a hospital event and they'll get home and they'll see the bill and they say, thank God that I have insurance. Actually, the bill doesn't reflect what the hospital has actually accepted or paid. And that's part of the problem. So let's migrate away from this confusion. If you're an administrator, be transparent. Charge a reasonable fee for what you need to do to keep your business alive. But don't inflate that for those that don't have insurance or they're paying with the health savings account. And just think about this. What if your accounts receivables were down to zero? Wow. So how do you get there? You don't get there overnight, but you can start migrating towards attracting people that pay at time of service. And how do you do that? Talk to some of your local insurance agents. They're the ones that know who has a health savings account. Talk to the businesses, especially the small businesses that come to your clinic or your healthcare facility. Talk to the small businesses because they are migrating away from insurance-based to information-based. Information meaning clarity regarding what things actually cost and then how to make that medical need happen at the most cost-effective, efficient, and effective way. So as an administrator, I want to encourage you. You're very important in keeping the practice alive. As a hospital administrator, you have an importance to keep the hospital healthy, but also serve your community. Many hospitals are challenged right now for a number of reasons. I strongly believe that if hospitals don't change the way they do things, they are really going to suffer even more in the very near future. Let's rebuild our communities, one community at a time. As an administrator, you're an important part of this transition. Thank you for considering the thoughts that I've shared with you, for becoming a member of Embrace. We would like to rebuild healthcare one community at a time, beginning with you.